Welcome to Community Health Heroes, where we spotlight local leaders and organizations that provide much-needed health and wellness resources and information. Our hope is for everyone in our community to strive to live healthier, happier, and longer lives. I'm your host, Leslie Snedowski. Thank you for joining us. Today on Community Health Heroes, we'll be talking about your heart and your lungs with some great guests who'll have important news to share about local initiatives that should get your blood pumping. First, we'll be speaking with Shelly Williams with Hub International. Hub is one of the sponsors for the upcoming American Heart Association's New Orleans Heart Walk, and she'll tell us all about the 1-mile pulse racing fundraising walk that takes place this month. Next, we'll be taking a deep breath with Jim Pittman, the community outreach spokesman for the Smoking Cessation Trust. He'll talk about the Great American Smokeout and share some major announcements coming from both the FDA and the tobacco industry regarding smoking. Lung cancer is by far the leading cause of cancer death among both men and women, but there have been some recent treatment breakthroughs that are helping to prolong the lives of those who have it. That's at the heart of our Community Health Heroes report. And the American Heart Association recommends eating fish at least twice a week to benefit from the heart-healthy fats it provides. That's why we didn't skip a beat when inviting the general manager and chef of Ninja Restaurant, Ricky Toy, and Eat Fit NOLA ambassador, Emily Eickhoff. Ninja is a popular New Orleans sushi and Japanese restaurant, and you won't want to miss this breathtaking cooking demonstration. So don't go away, because we'll be right back with more Community Health Heroes.
When I was 6, my mom had a stroke.
I'm Paul George. Learn the signs of a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Spot a stroke fast.
Welcome back to Community Health Heroes. Did you know the American Heart Association is the nation's oldest and largest voluntary organization dedicated to fighting heart disease and stroke? It was founded by 6 cardiologists in 1924 and now includes more than 22.5 million volunteers and supporters. One of them, Shelly Williams with Hub International, is with us to talk about the American Heart Association's New Orleans Heart Walk. Good to see you, Shelly.
It's nice to see you as well.
Tell us all about the American Heart Association's New Orleans Heart Walk. When is it and where is it?
We are so excited. The Heart Walk is on November 11th this year. It's going to be held in Champion Square. The festivities start at 9 a.m. and the actual walk starts at about 10 o'clock.
And what's your fundraising goal this year?
So the entire fundraising goal for the American Heart Association is $750,000 for this year.
Are you close at this point? Are you still looking for a lot of donations?
We're always looking, yes, absolutely. It's going well, and we're really excited about the event.
And how many people are you expecting to come and participate?
We're expecting about 5,000 people to attend, and hopefully they'll all take part in the walk. It's going to be a family fun day, so there's lots of fun things planned. The kids are coming out. It's going to be a great day to kind of promote healthy lives and get everybody going.
Shelly, I know there's going to be a really cool band performing at this event with a really cool name. Tell us all about them.
There is. It's the New Orleans Arrhythmia Band, and they started off as a jazz band, and they've kind of conformed into a dance band now, and there are 3 lead singers and a 4-piece horn section.
Wow.
It's made up of East Jefferson Hospital personnel, so very, very cool and very fitting for this event.
So I know the New Orleans Heart Walk is this very exciting day for people in New Orleans, but it's not the only heart walk that goes on throughout the year. How big is this initiative across the nation?
You're right. The event that we're holding in New Orleans is big and it's great, but you're right, it's not. We have over 300 walks going on.
300?
Yeah,
nationwide. It's all over the calendar, right? It's not all.
It's all over the calendar, and at the end of it, about 1 million Americans will participate in the walk nationwide. So,
why do you think it's so important to spread awareness about this issue, and how do the walks kind of help facilitate you guys spreading the message?
Right. You know, the heart obviously is one of the most vital organs, right? So it's critical that we take care of ourselves and take care of our heart. So raising awareness to heart disease and stroke awareness is so very important. And walks like this actually do that, right? So they get out into the community to make sure people are aware that there are things that they can do in advance to help promote healthier lives, healthier communities, and just bring that awareness. So I think that's why these walks are so powerful.
And I know the American Heart Association has a lofty goal. It's called the 2020 goal by the year 2020. Tell us what the targets are for that.
So they would like to, or we would like to reduce cardiovascular disease by 20%. And then reduce the amount of deaths caused by cardiovascular disease by 20% by 2020. So we began that in 1999. It's been going really, really well. And so that's been the goal. And it's been, an aggressive goal, but it's been great. We've seen a lot of, it's been progressively getting better year over year.
The American Heart Association promotes several lifestyle activities, and I know it's something that you're going to try to convey this message also to people on the walk. Can you tell me what those activities are? One
of the misconceptions is that people, when there's an incident, they go to the hospital nearest their home, and that's always not the best case in every scenario. And so raising awareness that, that there are better options, and that also, calling 911 as opposed to trying to get there yourself is a big thing that they're trying to raise awareness that there are different hospitals that can serve you in different ways that may actually be life-saving to you.
And that would just save a lot of time because you only have a few moments. I gotcha. So if someone wants to get involved in the American Heart Association New Orleans Heart Walk, how do they register? Where do they go?
So the best way is to go to the website, neworleansheartwalk.org. They can jump on the website, register, come on out on November 11th. It's going to be a ton of fun.
And I take it biggest advice is to wear comfy shoes?
Oh yes, comfy shoes.
It's a mile, right?
Yes,
so it's not
a mile.
Too long.
That's correct. It's a mile, but they have different physical activities going on throughout the event. So there'll be lots of ways to get in there and get active. Gotcha.
Well, great. It sounds like a great event, and we're so happy that you're able to come on the show and tell us a little about it.
We are so excited to be a part of it. So thank you very much.
Well, thank you. When we return, Jim Pittman with the Smoking Cessation Trust will tell us about the upcoming Great American Smokeout and information for those of you who want to kick the habit. So don't go away. We'll be right back with more Community Health Heroes.
It takes less than 1 minute to find out if you may have prediabetes, and you can do it here. So what are you waiting for? Just go to the site.
Welcome back to Community Health Heroes. Did you know smoking kills on average 1,200 Americans every day? The American Cancer Society's Great American Smokeout is held on the third Thursday in November each year, and smokers are encouraged to use the date to take an important step towards a healthier life by making a plan to quit, or by planning in advance and quitting smoking that day. Here to tell us more about the Great American Smokeout and the resources available to Louisiana residents who want to quit smoking is Jim Pittman, the Community Outreach Spokesman for the Smoking Cessation Trust. Welcome to the show, Jim. Thank you so much for coming on.
Thanks for having me.
Let's start by talking about the Great American Smokeout. What exactly is it?
The Great American Smokeout is every year at the same time, the third Thursday of November. The American Cancer Society encourages smokers to quit for cigarettes for 1 day, and with the hopes that they will quit for 1 day and continue to quit. So here in Louisiana, the Smoking Cessation Trust and our partners, our healthcare partners throughout the state, are encouraging smokers on November 16th to quit smoking for a day, and hopefully to continue to quit throughout the rest of their lives. And if they need help, the Smoking Cessation Trust and our partners throughout the state are here to help.
Well, let's do a little remedial smoking here. 101, tell us about the dangers of smoking. What diseases does smoking cause? And tell us about secondhand smoke too.
Besides the obvious, like lung cancer, heart disease, emphysema, smoking contributes to acute myeloid leukemia, cancer of the mouth, esophagus, larynx, lung, stomach, kidney, bladder, and pancreas, to name a few.
Oh my goodness.
So there's a number of diseases that are caused not just by smoking, but by secondhand smoke.
I'll tell you, listening to that list, I think you recruited a couple of people to take part of the Great American Smokeout.
I hope so. I hope we recruited them to be part of the smokeout on November 16th, but also, if they need help and started smoking before September 1st, 1988, the Smoking Cessation Trust and our healthcare partners throughout Louisiana, and it's a growing list of healthcare partners, so we're all ready to help any Louisiana resident that started smoking before September 1st, 1988 to just quit.
Now, you mentioned that date twice. Why is that so important? Is that something to do with the Scott class?
That's exactly right. The Smoking Cessation Trust is the result of a judgment in the class action lawsuit. It defines basically who is eligible for these funds that have been set aside to help folks quit. So, anybody that fits that criteria, and all it is to live in Louisiana and have to started smoking before that date, you can join the 80,000 people who are now quitting with help of the Smoking Cessation Trust and our healthcare partners throughout the state.
Let's talk about some of the most recent developments. I know the FDA is coming out with some news, and so is the tobacco industry in general. Tell us about some of the developments.
I'm not an expert, and I think the FDA is still studying these things, and others are still are exploring what is best for the people of the United States. But right here in Louisiana, we encourage everybody just to quit smoking, and we want to help.
Tell me about the corrective statements we're going to be seeing soon on tobacco products. What's the latest on that?
A federal mandate is going to be forcing the tobacco industry to start publicizing in advertisements in late November. And they are really statements about the harmful effects of smoking that they've known about for years. How harmful cigarette smoking is to you, the diseases that they cause. They lied to the public for a long period of time.
Well, it's very exciting to see you being so excited about spreading this quit smoking message. So tell our audience where they can find out more about the Smoking Cessation Trust and how they can find help to quit smoking.
Okay, first of all, they can go to our website, and that's smokefreela.org, www.smokefreela.org. A lot of wonderful information about the Smoking Cessation Trust. You can follow us on Facebook, LinkedIn, Twitter, if you like, and or you can just call, and there's an 800 number, 855-259-6346, and an operator is standing by Monday through Friday, 9 to 5 to answer calls. And after those hours and on weekends, we encourage you to go to the website, and you can find out more information and enroll at smokefreela.org.
Well, I'll tell you, Jim, you sound very convincing. I'm sure a lot of people who listen today are going to join this effort of the Great American Smokeout this month.
I hope so, and I hope anybody that's watching encourages friends and relatives to sign up and to, or at least quit for a day during the Great American Smokeout on November 16th. That's Thursday, November 16th.
Well, thank you so much for joining us and telling us all this great news about the event. Thank you.
Thank you, Leslie. I appreciate the opportunity.
Oh, of course. Pleasure. When we return, the latest on treatment options for lung cancer in our Community Health Heroes report.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. The pressure's too much. I quit.
I get it. I can do better. Just please don't leave.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Did you know about 1 out of 4 cancer deaths are from lung cancer? Each year, more people die of lung cancer than of colon, breast, and prostate cancers combined. In recognition of Lung Cancer Awareness Month, I found out about some of the latest diagnosis breakthroughs and treatment options for lung cancer that are helping people beat the odds with targeted therapies in this Community Health Heroes report. In 1939, Dr. Alton Ochsner, one of Ochsner's founders, was one of the first to discover the link between tobacco use and lung cancer. Today, at the Gail and Tom Benson Cancer Center at Ochsner, doctors continue groundbreaking work to diagnose, treat, and cure lung cancer.
I'm usually the first point person when somebody is found to have an abnormal CT screen, a spot on their lungs or something else like that. And so, first of all, it doesn't always have to be cancer, but if it is, we're getting better every day at treating it.
Dr. Susan Gunn, a pulmonologist and member of Ochsner's thoracic oncology team, often consults with Dr. Marc Matrana, a medical oncologist and medical director of the Ochsner Precision Cancer Therapies program. She said treatment options are getting better, and they're finding out new ways to combat this deadly cancer.
It used to be a really grim prognosis, but I have seen really advances every day. Our oncologists are saying it's like a kid in the candy store because they're having so many more new options in treating their lung cancer. And we're finding out more and more about the genetics behind it all, and being able to target those mutations to really attack the cancer and control it.
Dr. Matrana said in the past, doctors lumped all advanced lung cancers into one category and usually treated them with chemotherapy. Now, especially for non-smokers who develop the cancer, molecular and genetic testing are used to guide their treatments.
Today, we're not so much looking under the microscope and looking at what the cells look like. We're actually looking down to the genetic level and looking at certain mutations. We know that lung cancers are actually each driven by what's called a driver mutation. And in many cases today, we can identify that driver mutation. And in some cases, based on that driver mutation, we can recommend a targeted therapy for that specific mutation.
Dr. Matrana said many patients are taking advantage of immunotherapy drugs that unlock the immune system's ability to identify and fight cancer. Another initiative Ochsner is providing is next-generation tumor sequencing.
We actually have a bucket trial right now which allows patients to have free of charge deep tissue sequencing on their tumors, allowing us to test for more than 100 different types of mutations that may allow us to find an experimental treatment that could be very tailored to their specific genetic alteration, or to guide our treatment through the currently available therapies that are available FDA approved. This trial not only will save patients a lot of money because the testing costs between $5,000 and $6,000, but will also allow us to really, in a very precise way, pair patients with therapies that are efficacious, that have minimal toxicities in most cases, and which we have a high confidence rate will work well for them. Most of the targeted therapies have very limited side effects as compared to traditional chemotherapies, and many of them are available in pill form. I think in the next 5 years, we are going to use genetics and genomics to a much greater and deeper level. And I think our understanding of how the current therapies work, the current drivers of cancer, is only going to get better and better, allowing us to really tailor therapy for each individual patient.
Based on a national lung screening trial at Ochsner, Dr. Gunn said she recommends patients aged 55 to 77 who smoked to get a low-dose CT screen to look for lung cancer.
Although there's a lot of science behind what we do, I always tell patients I see miracles every day when it comes to treating lung cancer.
I'm Molly Kimball, registered dietitian and founder of Ochsner's Eat Fit NOLA. We've collaborated with more than 100 partners locally to create Eat Fit NOLA, a partnership that highlights the better for you items right there on a restaurant's menu or on grocery store shelves, making it effortless for you to dine at your favorite restaurant or shop your favorite market without ditching your otherwise healthy diet. Every month, Community Health Heroes Show, which is sponsored by the United Health Foundation, will shine a spotlight on an incredible chef to help show you how you can make smarter food choices to live a healthier, happier, and hopefully longer life. In addition to Eat Fit NOLA, you can find our partners such as Eat Fit North Shore, Eat Fit BR, Eat Fit Bayou, and coming soon, Eat Fit Acadiana in a neighborhood near you. So don't go away, Community Health Heroes will be right back.
Well, Thomas, you've got prediabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon, too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have prediabetes. Big time.
Eating sushi is a great way to increase your fish intake, which is good for your heart, but not all sushi is created equal. Joining us in the kitchen is the GM and chef of Ninja Restaurant, Ricky Toy, and Eat Fit NOLA ambassador, Emily Eickhoff. Welcome to the show.
Thank you so much for having us on.
So I know that sushi is supposed to be really healthy, but it's really about how you prepare it. So tell us, what are you making today and what's so good about it?
Today we're making sushi with brown rice, and the wrap is going to be made out of soy paper. And then we're going to have fresh salmon, fresh tuna, fresh yellowtail with the vegetables going to be cucumber, avocado, and asparagus.
Well, it smells like we're standing in a garden. Everything smells delicious already. Emily, tell us a little about why some of these ingredients are so special and so good for your diet.
Yes, definitely. Well, Chef Ricky and I have been working very closely over the last several months coming up with an Eat Fit menu, and you've been so great with having Eat Fit options at Ninja. So we've added a cucumber wrap instead. We also do a soy paper. Lettuce wrap is a great low carb option, and brown rice as well, because you have the fiber with the brown rice. So.
Yeah, Chef Ricky, what are you going to be starting with? Because I know you're also going to do a chicken dish first as well. So what are you going to show us first?
I'm going to start you off with a chicken lettuce wrap.
Okay.
And it's going to be boneless, skinless chicken that's chopped. You can use turkey. If you're a vegetarian, you can use tofu in place of the protein. And then I'm going to saute it, and I'm going to add shiitake mushrooms, water chestnuts, if you like water chestnuts in can, or you can use fresh jicama. It gives it a little crunch. A little fresh garlic, some scallions, and then the sauce, we're just going to glaze the pan with a little mushroom soy, oyster sauce, some rice wine, and a little sugar and white pepper.
So how hot do you have to keep the pan before you put the chicken in?
We want to bring it to a nice hot temp. So once you put the oil in, it should like dance in your pan. And once it does that, we're going to add the chicken.
I'm anxious to see how this is going to smell too, because this part, it smells delicious right here.
Just a little oil to get your pan wet and where it won't stick. We're going to add the chicken.
And Chef, while you're preparing this, you have to tell us a little about, you're really like a celebrity chef. You've worked with Wolfgang Puck, you've worked with the Brennan family, with the Wong family of Trey Yen. You've had a very interesting background. Tell us a little about some of the restaurants you've worked at.
Well, I started working, I grew up in a restaurant. My parents had a restaurant. And when I decided to go into being a chef, I went and worked with the Wongs at Trey Yen for a little while. Frank was a big help for me, and told me that there's no substitute for fresh quality ingredients.
That's good advice.
And that's what I took from him. And so I added some fresh, the water chestnuts, and then shiitake mushrooms. I put a little garlic in there. And when you're cooking the chicken, it was about 80%, and then I wanted to add the remaining ingredients so I can bind it together.
And when it's cut so small, it makes it really easy. It cooks very fast, so that's also.
Add a little scallions for more flavor.
Now, is this a very popular dish in Ninja?
Yes, Leslie, it's real popular. It's, as Emily mentioned earlier, it's at Eat Fit NOLA. It's really healthy, low carb, and it's and then what we're going to do when we use the lettuce, it's going to be as like the shell, like a taco shell or a tortilla wrap. Here's the I'm going to just add a little sauce. It's just a little mushroom, soy, oyster sauce, sugar, a little bit of sugar, rice wine, and white pepper.
I'm definitely starting to smell it on this side of the table. This is really yummy smelling.
Yeah, it smells amazing.
It looks pretty too.
And this is basically it for the dish. I'm going to plate it for you. Thank you, Emily. Just turn the fire off. Okay. Just plated the chicken, and then this is fresh iceberg lettuce. Made it into a cup, and we just put it right here. And what we do is we serve it with a little serving spoon, and we make it into like a taco.
Oh, so you do it yourself at the table like that,
Yes.
and you just roll it up in the.
Correct.
Oh, that's wonderful. So now that we're done with the chicken, let's move on to the sushi. I'm dying to see the sushi demonstration.
Okay, great. We're going to use a soy paper wrap. It has some sesame seeds here, and we have some brown rice, and we're going to just form a mat on this. So what we have is we're going to put some fresh salmon and some fresh tuna.
And how many servings does this make?
This comes in, once I make it, it's going to cut into 8 pieces. So it's 1 serving, but sometimes most people would like to eat more than 1 roll. But it's something that can be filling enough for 1, especially for lunch. And so we're just going to do the mat. And
well, while you're cutting this up, I have to digress one more time. I also know you're big into martial arts. Could you tell us a little about that and your history with martial arts? That sounded so fascinating.
Sure. I started when I was a young teenager, and I studied Chinese Kung Fu. And for me, it's more like a way of life. And it's just like I tell people, getting up and brushing your teeth, I just do Kung Fu. Mm-hmm. So this is the roll, and I added some fresh pickled ginger and, of course, the wasabi. And there we go.
Looks beautiful.
That is amazing.
Okay, so break some of this down for us. When you're sitting down, what are you looking at in terms of nutritional value?
So you'll find on the Eat Fit menu at Ninja, everything is going to be very high in protein, especially with all the fish and the chicken. Vegetables, you're going to get a good amount of vegetables. You have your asparagus and your cucumber, healthy fats with the avocado. This roll is about 150 calories, but it has over 25 grams of protein.
Well, it sounds like you all have a really great relationship. How long ago did you all start working together with Ninja and Eat Fit NOLA?
It's been about 3 or 4 months. We were introduced through Uber Eats, so you can now find all of your favorite Eat Fit options on Uber Eats and also Waiter as well. But we met through Uber Eats, and so it's been a great relationship since, and very wonderful working with Chef Ricky.
And before we wrap this up, I also wanted to see what that is exactly. What do you have prepared there?
That is a cucumber wrap. It's called on our menu a moriaki roll with cucumbers as the wrap instead of the nori or soy paper. And it has fresh yellowtail, tuna, salmon. We put some daikon radish sprouts and mesclun mix.
Is that right over there?
Yes, it is. So it's all fresh. It's all nothing fried, all fresh product, raw fish.
A dish like this with that amount of soy sauce, I would say, is one of the most perfect things you could eat.
The way it's wrapped is so beautiful. It's like a perfect coil. It looks great. So tell us a little about the restaurant. Where is it? How can people find you?
We're on Oak Street, 8433 Oak Street in New Orleans, uptown, and we open 7 days a week. And you can give us a call anytime or go to our website, Ninja Sushi in New Orleans.
Great, and our audience is definitely going to be looking at our website and our Facebook to see some of the preparation and the ingredients and the recipes for all the dishes you made for us today. So thank you so much for both of you for joining us.
Thank you.
And we'll be right back with some more Community Health Heroes.
Hey, Hard, what's this? That's my resignation. You're resigning. Why? You've been putting me under a lot of pressure lately. That's why I'm ready to quit. Oh, I forgot. I'll do better. Please don't quit on me.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Thank you for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com. If you'd like to learn more about our guests and share segments from our show, check out our website at communityhealthheroes.org, and you can also find our show on YouTube. We hope the information we've provided you on the American Heart Association's New Orleans Heart Walk, the Great American Smokeout, the latest on lung cancer treatment, and the heart-healthy benefits of adding fish to your diet will help you and your family live healthier, happier, and longer lives. I'm Leslie Snodowski. Make sure to join us next time for more Community Health Heroes.